Good evening, everyone. And while we wait for more people to join in, I hope that you all are keeping safe. You're at home. Let's start on an optimistic note about COVID. There are a lot of good work happening out there. There are a lot of research is happening on an everyday basis. So be it in terms of treatment, be it in terms of the new antivirals which are being tried out, the debate on chloroquine versus hydroxychloroquine, the role of BCG vaccine, then the latest therapy on the plasma transfusions from the COVID patients to the new ones, and of course the most awaited vaccine. So there's lots happening out there. As you have seen in the past time that COVID is an evolving condition. There are guidelines being formulated every other day because as time goes by, we are understanding more about the disease. Let's be optimistic and keep reading and keep following good sites, formal sites, for example, Government of India or Ministry of Family and Health, which will give you authenticated information about what's going on. As I said, that because these are evolving guidelines, earlier mask was not mandatory. Now mask is mandatory because as more work is being done, we realize that there could be aerosols for some particular time in the air. Fomites could be there. So everybody is supposed to wear a mask. You need not wear a surgical mask. Keep them for the hospital and the health workers or the frontline workers. A simple cloth handkerchief can do, and it's usable. Imagine a mass population of India. If everybody wears a surgical mask, you're going to discard them after use. It creates a lot of biomedical waste. Two, not everybody can afford them. So simple cloth when you're wearing, you're protecting, other people from your cough and cold, because a lot of us droplets, because a lot of it could be asymptomatic carriers. So follow those kind of guidelines rather than on WhatsApp universities and what you read from here and there and the myths, because this is an evolving condition, as I said. So let's base our information, because that's going to be one of the most important thing in preventing the spread of virus, that you have to empower people by disseminating proper scientific information. The source of information is very important. So go to the ministry sites, go to the Government of India site for information, go to your local, DC sites. And for anything scientific and medical, go and read research papers rather than random suggestions or random newspaper articles, because there's lots out there. I mean, the social media is there at the tip of the hand, and the negativity is not going to help us in any which way. So let's be more aware and let's be informed, about the disease. So coming to eye problems in this time, what I'll do is that based on the kind of calls that we are getting, people are locked down and are not able to come for routine checkups. So based on the type of calls we are getting, I'm going to address those things first. And then, of course, we'll take your questions. So you can, log in and keep your questions coming on. First and foremost, what is happening most commonly is conjunctivitis, because Delhi NCR is now, starting with summer seasons, which is a time of conjunctivitis. So if you have red eyes, sticky eyes with mucus or discharge, it could be conjunctivitis. Now, this can happen with or without fever. Sometimes you have a preceding viral illness, your immunity is low, and you can pick up infections from anywhere. There was a bit of a scare that conjunctivitis could be a presenting feature of COVID. Now, that the answer to that is both yes and no. Yes, it's possible, but the incidence is very less. So, from the data of current COVID positive patients, some have had conjunctivitis viral as a presenting feature, but that incidence is 1%, and in some studies it maximum went to 2%. But it is not yet one of the established presenting factors. So don't be scared if you have a red eye. Let's treat it like a general viral conjunctivitis. And COVID, also for that matter, is a viral illness. So the way you had cold, cough, viral illnesses earlier affecting different parts of your body, this is one of those conditions. Just the difference is that it's highly contagious. It transmits very fast, and the mortality that we are seeing is varying from 2 to 5%. But otherwise, it's just a virus. So, if you have conjunctivitis, what you should do, one is prevention for other people to get infected, because again, it's contagious like any other viral conjunctivitis. So, keep your hands sanitized. That we all are doing any which ways these days. So, hand hygiene becomes very important. You can do a bit of cold compress. So you can use ice packs in a tissue paper, or you can wash your eyes with RO water. And you'll have to use anti-inflammatory eye drops, some lubricating eye drops, because in conjunctivitis, there's a bit of an eye strain. If there is discharge, means it could be a superadded bacterial infection also. So we will need to give you antibiotic eye drops. You can also do cool compress by gel mask. And not sharing your linen or your bathroom material is very important to spread the contamination to others, or to check your other eye that it doesn't get affected. What you need to do is maintain hand hygiene. Make sure that you do not touch your eyes. So most of the people who are wearing glasses are anyway safe, because it's very difficult for us to put our fingers inside the spectacles and touch our eyes. And apart from that, people around you also. How conjunctivitis spreads is that you touch your eye, then wherever you put your hand, the other person comes across, puts the hand there, touches his eye. So that cycle has to be broken. So once I have washed my hands frequently, and the people around me are also washing their eyes, even if they accidentally touch their hands, even if they accidentally touch their eyes, it's all right. The infection is not going to spread. So if you're not able to go to the doctor, these are the basic simple steps that you can take to take care of your conjunctivitis situation. One word of caution for contact lens wearer. So I have had some calls, people asking, can I or should not wear contact lenses? Yes, you can if you're healthy and you're not having any other symptom, but be more careful about the hygiene of your contact lenses. So earlier you were washing your hands before putting the contact lenses. Now I would suggest that wash your hands in between putting the right and the left contact lens. Make sure that you're cleaning your case every now and then. But if you're at home, let your eyes breathe. Wear more glasses. They're definitely more safer. But it's not a contraindication in these days that you cannot wear contact lenses. Of course, if you're coming up with red eye or there's a bit of a discharge, then you would want to avoid contact lenses. So that's conjunctivitis. Second is, now that we are all home, spending so much time on screen. So whether it's entertainment or whether it's your phone, social media, work, everything is happening on Zooms and other platform. Children are doing their schools, colleges, assignments on laptops and computer. So what all precautions should you do or take care of? And what does it do to your eyes? Now, there is no way getting away from the digital world now that the lockdown is also going to extend. And even after that, there won't be large gatherings and crowds. So most of the work is going to be digital. That's the way forward. Now, what happens is when you're on a screen, we are unconsciously blinking less. When we blink less, the tear film evaporates. And now that the summertime is there, so you have the fans running, you have the air conditioning, air coming on. So the tear film evaporates faster. So you're blinking less, the tear film also evaporates faster, and you get a dry eye condition. So, you will have tired eyes, you will have burning sensations, stingy sensations, the eyes may become a little red. All those are symptoms of something called as either a digital strain or a computer vision syndrome, as a part of the eyes getting fatigued and becoming dry. Now, why do they get fatigued is when we look at a near object, so be it reading, mobile phone, laptop, it's either at a near distance or at an intermediate distance, and you're using accommodative muscles, the ciliary muscles inside the eye. They are constantly working, and that makes you feel fatigued because of those muscles working all the time. So how do you take care of this situation? So let's start from the basic position of how you're sitting when you're using the screen, how the light should be, where the laptop should be, and what I can do intermittently so that they don't get tired out. Because as I said, that this is a long drawn situation. There's no getting away from the screen. Now the parents can't turn around and tell a child that don't use a screen. He'll say, I have to do a lot of schoolwork. I have to do my college assignments. What do I do? So first and foremost is ergonomics is very important. When you're sitting to work on the computer or laptop, make sure that you're sitting in a comfortable position, a straight position, and the laptop is either at your little below your eye level. So the exact screen position is at least 20 degrees down on an incline. See, because by common sense, if it is at the same level or if it's a little higher, your eyes open up wider, exposing more surface area for the tear film to evaporate and cause more dry eye. So make sure that your position is okay. Your wrist should not get a lot of pressures while that. Don't strain your neck. Check on your position properly, because long usage of hours, it's not just the eye. Everything gets added on. It could be just ergonomics and you feel it's an eye problem. In your laptop, make sure that you're keeping the brightness and contrast adjusted. Some people use an anti-reflective screen on front of the computer, but again, it's not like a hard and fast rule. Whichever way you feel it's comfortable, you can very well adjust the brightness and contrast in your screen itself. In glasses, a lot of people ask whether anti-reflective coating or the blue filter light cutting methodology works. Uh, it does. You can choose to wear these kind of glasses when you're on the screen. So make sure that your position is okay. Make sure that the height of the screen at what you're using your laptop computer is okay. Now, the most important part is the frequent eye breaks. Now, if I tell you to take more pauses or blink your eyes frequently when you're on the screen, that's not possible because you're either too absorbed in the entertainment watching a movie or you're too absorbed at your work. You will not remember to blink that often. So we say either a 10-10 or a 20-20 methodology. What that means is that every 10 minutes, give pause and close your eyes for 10 seconds, or 20-20-20, which means that every 20 minutes look at a 20 feet distance, means look away for 20 seconds. So by that methodology, you're giving rest to your ciliary muscles, accommodative muscles, so your muscles are not getting so fatigued, and also it rejuvenates your tear film at that time. So you can do simple things, put a fluorescent sticker or a reminder on your laptop, with a smiley face or something, that blink more frequently or look away or take pauses. So frequent eye breaks. And secondly, using lubricating eye drops, which are preservative free eye drops. You don't need to come to us. You don't need to come to OPD to get a prescription. These can be taken over the shelf, over the counter kind of drops. There are quite a few one out there in the market. So you can use these lubricating eye drops couple of times a day. They have no side effect whatsoever. You can also use these gel masks. So you have these eye masks which you keep in the fridge, and they're like cool compress. So they give a lot of relief to the eye. So anything more we'll take up in the questions. Now, thirdly, coming to a set of people who we are very concerned about in this lockdown period is glaucoma patients, because they are the ones who come for regular follow-ups. First and foremost, let me assure you that glaucoma, most of the glaucomas are slow progressive diseases. So nothing will go wrong in few weeks. Stay put. Keep putting your drops regularly. Don't, even if you miss them, the next time you remember, put those drops. Two important things here is, because it's a time where you have to keep yourself protected and be very, very hygienic. For glaucoma patients, we say that when you put the drops, we ask you to occlude the punctum. That's the area between the eye and the nose for 60 seconds, so that the drops don't go through your nose, throat, and into your systemic circulation. So there are less side effects that way, and the efficacy of the drop increases in the eye. We ask you to do punctal occlusion, close, put a finger there with pressure, and keep your eyes closed for 60 seconds, which helps in the absorption of the drops. So make sure that when you're doing that, your hand hygiene is proper. Don't forget to do that, because this is a vulnerable area. Nose, mouth, and your eyes. For the next few months, remember that this is a no-touch area. So when you, or if you're doing it and you have to, then make sure that you've either sanitized your hand prior or you've done a thorough hand wash. So when you're doing punctal occlusion, don't forget to hand wash. That's one thing. Secondly, if there is something which needs urgent attention, please don't be scared of going to the hospitals or OPD, because they are taking many, many, many precaution and preventive measures. Like, between, there is going to be social distancing in hospital henceforth. There is going to be disinfections, lot of surface disinfections being used all the time in the hospitals, on doors, handles, knobs, because we don't want that the lockdown causes any detrimental effect which we cannot come back from, or we feel sad about that, oh, why did you not come to us earlier, right? So I understand the fear, and we are also requesting patients not to come for elective things, simple glasses, prescription, and other things which can wait, stay put. But something, if you feel that your vision is going down, or if you get a black spot in your eye, if you see floaters, if you see flashes, which could be retinal problems. In glaucoma, if you get sudden acute rise of pressure, if you feel pain in your eyes, and if there's a red eye, then you will need to come to the hospital. And we are going there regularly with a lot of precautions from both patient's perspective and doctor perspective. They are being taken. When you come to the hospital, couple of tips. One is wear a mask, and preferably tape it on your nose. So you get these micropores, those paper kind of tapes. So make sure that it's not a loose, dangling kind of mask. Just wear a proper tight mask, tape it at the nose, you're very secure. Bring a sanitizer with you and go around with a no touch policy. So if you're taking an elevator, don't put your fingers on the elevator button, just use your elbow. So if you come with a no touch policy and if you keep your mask on, it's pretty safe. Bring your reports. Don't forget to bring your earlier reports of perimetry OCT, because if we are taking your pressure and I feel everything is all right, or any glaucoma person sees you that your pressures are okay, and your perimetry OCT has been done for some time back, we need not put you through all the tests, and it will save your hospital time as of now. So keep putting the eye drops, and you can always reach out to your doctors, because most of the hospitals and clinics have started teleconsults. So we are doing audiovisual. Of course, you can't take your eye pressures, but small little problems here and there can be solved. And there's a lot of comfort factor when you talk to your doctor. He'll be able to advise you whether you can stay put at home, keep putting eye drops, whether you need to come to the hospital urgently or not. So reach out, like find out in your locality which doctors have started doing teleconsults, and we are doing that a lot. We are formally taking appointments, and we are doing an audio visual to help you out over there. So that's pretty much it from my side. We can look at some questions meanwhile. So there is somebody asking what kind of glasses can I use for computer. So as I said that for your computer work, you can there are 3 4 options. One is having these blue cut filters, spectacles, lenses which cut the blue spectrum of the light. That's the one which is detrimental for the eyes. Then some people who have a lot of photosensitivity and glare can go for photochromic glasses. You can also get an anti-reflective coating done on your glasses to cut off the lights, any kind of sensitivity and glare. And screen, you can adjust your screen brightness and contrast sensitivity, and make them comfortable according to your sensitivity levels. So Vinna says, how many times I should be washed if one is suffering from conjunctivitis? So there is no real dictum of how many times. A couple of times a day is okay. So you can space it out. So once in morning, once in afternoon, just for comfort. Suppose you're absolutely comfortable by just putting eye drops. There is no mantra that you should be washing your eyes. Washing your eyes is mainly if the people are getting a lot of discharge. So it decreases the debris and the discharge in your eye when you're washing them. And if you're using cold refrigerated water, like I tell my patients that instead of tap water, you use refrigerated RO water. One, it's sterile, safe, relatively clean, safe, and it's cold, so it is soothing to the eye. So a couple of times a day, you can wash your eyes. So Pawan, you're asking, can blue light cause glaucoma and the sunlight problem to the glaucoma patients? No. So the lights don't have any effect on glaucoma. Now there are various types of glaucoma. There's not just one type of glaucoma. Glaucoma is a group of diseases which affects the optic nerve in various ways, and eye pressure is one of the causes. And then there are other causes also. So these are all inherent features. There are some secondary glaucomas which can happen as a result of something else, like eye problems, or if you've taken steroid eye drops for a long time, some kind of injuries can cause glaucoma. Some people are, so these are secondary glaucomas which happen because of some other causes. But the primary glaucomas which you can have, like an open angle glaucoma or a narrow angle glaucoma, some children are born with glaucomas, congenital. The light really doesn't have an effect of it on it. So either it's genetic, it can happen randomly to anybody. The prevalence and incidence of glaucoma, for example, is say 2 to 4%. Out of every 100 people, there'll be 2 to 4 people who, without any reason per se, will have glaucoma, and it's a silent disease. Because it's a silent disease, it doesn't have symptom. Many a times people come to us late, only when the vision gets affected in the center, and by the time the changes are irreversible. So it's very important to screen almost everybody after the age of 40 when for glaucoma, because when any of these patients come to us in OPD above 40, every single patient's eye pressure is taken, and that's how we detect silent glaucomas. And then there is a certain category of patients who we choose earlier to start monitoring. So suppose if you're a have a minus number, if you're diabetic, if you have thyroid disease, if you've taken steroid for some reason for a longish time, these are people who are more prone for higher eye pressure. So we would want to screen them, more frequently, or maybe start their screening earlier. Otherwise, everybody after 40, once a year, and in their 50s, and later on maybe twice a year is how we screen them. But sunlight really doesn't affect glaucoma per se. Mukesh, you're asking for kids precautions you suggest as they are investing more time on mobile and laptops, video, online classes. So that's what I said. That's a very valid point, that children, there's no choice. They are on screen most of the time. So as I said, frequent eye breaks is important. Ask them to make it a habit to close their eyes every now and then. So if I close my eyes for the next 10 seconds like this while talking to you, this is enough to give rest to my accommodative muscles, and it's also rejuvenating my tear film. See, every time we blink, we are creating a tear film. There's a lacrimal gland here. It coats the eye, then through small punctum, it goes through the nose and throat. It's a 24/7 process. We don't even come to know it. Tear film has three layers. It has got, antibacterial property. It has enzymes in it. Protective layer is there. It has a lot of functions. So by closing your eyes every now and then, you're helping the tear film to build up. Also, look away. So every now and then while you're working, just tell your child to look away at a distant object. So that also breaks the pattern of that constant gaze. It can cause accommodative spasm and create minus numbers. So you will have children complaining of blurring of vision after being a lot of time on the computer, because the eyes create a little minus number by the spasm of the muscles. So as long as you're taking frequent breaks, you're relaxing your muscles. That's how these things get prevented. And if there is constant strain, for that, of course, you have to come to the hospital. If there's a muscle weakness, then we ask you to do push-up pencil exercises to strengthen your muscles. But not everybody requires that. So it's not like going to the gym and start working on your biceps for maintenance. So you don't need to exercise per se as a maintenance, but if you have that insufficiency, convergence insufficiency, which we tell you when you come to us, that's the time when you need to exercise. So for children, just frequent eye breaks while they are on the screen is sufficient. Make sure that the posture is correct, and make sure that their prescription glasses are okay, for which you'll have to come to us after the lockdown. Mr. Sajan is asking if reading books on Kindle is as good as on iPad tablets. Absolutely, it's absolutely fine, as long as the screen and brightness of the Kindle is adjusted. In fact, Kindle gives you an advantage of a daytime and a nighttime mode, where you can adjust your light accordingly on the Kindle, and you can have a good posture. So it's absolutely fine. Since these days, Sachin is asking if since days lockdown is going on, what we should do to avoid risk of getting dry eyes. We have mostly answered that. And some people are more prone for dry eyes. So for example, there are a lot of autoimmune disorders, rheumatoid arthritis, Sjogren's, and other autoimmune disorders. So people who have these diseases are more prone for dry eyes. People who have diabetes, who have thyroid, with eyelid problems, sometimes because the oily layer of the tear film is secreted by the eyelid glands, sometimes these glands get blocked. They are called meibomian gland or meibomial gland dysfunction. So people with eyelid problems will have more dry eye. Menopausal women will have more dry eye. So there is a certain category of people who are more prone for dry eyes. So they should take care of their screen time, preferably decrease it and put lubricating eye drops and be monitored intermittently under medical supervision. Mr. Chintha is asking, in glaucoma patients in their daily life stress, does it affect the eye pressure? That's a good question. No, that's a common myth. The routine life does not affect the eye pressure. In fact, many a times, the glaucoma patients get so psyched up that even if they're having a random ache or a mild headache, they come running to us thinking that the pressures have increased, because you're always living under this fear, but my eye pressure is okay. You wouldn't know otherwise. So no, not the daily life stress doesn't cause glaucoma. The only thing, since you've talked about the daily lifestyle, for a glaucoma person, there are no do's and don'ts in their daily lifestyle, not many one. One is, I always tell the patients to be careful about, if they are doing yoga, then they have to be careful about their yoga asanas. Some of the yoga asanas are not recommended for glaucoma patients. There's something called as Valsalva maneuver, where the pressure increases around in this area, gets transmitted to the eyes. So if you're doing Kapalbhati, for example, very very fast, then that causes fluctuation in your eye pressure. If you're doing head down positions, that can increase your eye pressures. So these two things we ask you that in glaucoma patients avoid, uh, you know very fast Kapalbhati and head down asanas. And caffeine drinkers, there have been some reports which say that for some people, not everybody responds to caffeine in that way, but for some people, say maybe few people, say one or two people out of 100, coffee increases their eye pressure. So that's pretty much it. Otherwise, you can happily just keep on doing whatever you're doing. There are no lifestyle modifications required for a glaucoma patients, except for daily reminders to put their drops regularly. Mr. Gupta is asking which is a good preservative-free lubricating eye drops for elderly patient if eyes are not producing tears. So there are quite a few ones in the market out there, and most of the chemists know, and it's even written on the drops that these are preservative-free. So I will not be taking any brand names here, but if you any chemist and you yourself can read on the eye drops, benzylconium chloride, and there are a couple of other preservatives. It will say no preservatives, so you can choose that. Mr. Pramod Kumar is saying, Doctor, sometime I feel in the left eye mosquito like black spot floating. So yes, that's a very valid thing. Those are called floaters. Lot of people have floaters, especially myopes, people who have minus numbers because their eyeball is longer, and the gel inside your eyeball is not empty. It's full of vitreous like gel. Now, if that gel becomes a little liquefied, because in myopes the eyeball is little longer, the gel becomes liquefied. In myopes it will be like that. In a lot of elderly patients it will be like that. The natural opacities in this vitreous will be seen outside as either threads or makhi machhar. They are floaters and they are part of the eye. 99% floaters will not cause any problem, but sudden increase in the floaters, like if you see a lot of these mosquitoes and a lot of black threads and like a big guच्छा बहुत सारा एकदम से अगर आपको दिखाई दे, और if you are having flashes ऐसे तारे जैसे दिखाई दे रहे हैं आपके साइड विजन में, that could mean a hole in the retina, a break in the retina, will need attention. तो एक बार जाके आप रेटिना चेक कराएंगे. But if there are एक दो मक्खी मच्छर or one or two threads, they can be omitted. Whenever possible, you just go for a routine checkup where your retina will be screened. Mr. Suman Kumar is asking, in normotensive glaucoma, how frequently patients should come for follow-up? It's in all kind of glaucomas, the follow-up is pretty standardized depending on the type of glaucoma, the stage of glaucoma, the age patients, which glaucoma specialist will tell you. So routinely we ask our glaucoma patients to come once in 3 months for a routine quick eye pressure check and other examinations. The field charting to see how much of your field has got affected, whether it's stable or progressive, is done once a year. If it's a stable glaucoma, but if it's a rapidly progressive glaucoma, then we may call you earlier. So if it's an advanced glaucoma and there are advanced field changes, only a very narrow part of your vision is remaining. If it's critical, I may want to do your perimetry again after 3 months or 6 months. So depending on the case, but by and large, stable glaucomas we call once in a year. And OCT, which measures your nerve fiber layer thickness, again depends whether you want to do yearly or two yearly. So it's all very customized. It's all very tailor based depending on your profile. And as I said, that it's not one type of glaucoma. Even in normotensive glaucoma, depending on your profile and your field changes, and how you're progressing and your other parameters, how well they are controlled, whether your blood pressure is okay, whether you don't have nocturnal hypotension, means your BP going down at night time, other things. Everything goes into account, and your glaucoma specialist will decide how frequently you have to come. But if you are a stable glaucoma patient, then I would say for routine checkups once in 3 months, and for exhaustive tests and everything, that exhaustive long checkup which you come for is once a year. Mr. Shamrose is asking what can be done when a patient suffers from sudden IOP rise in angle closure glaucoma during lockdown. Patient is having history of angle closure glaucoma before. Can we give oral Diamox along with other anti-glaucoma medication in case of medical emergency? So not by yourself, because sitting at home, sudden high pressure, you wouldn't know whether your pain is because of the IOP increase only, because there are few other eye conditions which will simulate the symptoms and will present like acute angle closure attack. Basically, you have pain around the eyes, you have headache, the eyes become red, you can have vomiting, but just by those symptoms and self-medicating is an absolute no-no. You will have to go to hospital, and as I said in the beginning of my talk, I understand the concern of your not being able to come, but please don't not come to the hospital and cause a damage which is irreversible later. As I said, that the hospitals are maintaining a lot of sanitizing efforts, lot of surface disinfectants, proper care, proper spacing between patients. So we don't want you to be in a situation where it's a problem later on. So if it is an acute angle closure glaucoma, if it's the pressures are rising, please talk to your doctor and go and visit him. What should be done to a patient suffering from macular degeneration and glaucoma? There's a very intelligent audience out here. Well, they glaucoma will be treated like glaucoma. Now, ARMD is a macular degeneration. They are usually not linked. So, macular degeneration, age related, as the word itself says, is a problem of senile age group. Again, no real reason why it happens. It can happen to anybody, especially with a family history of ARMD, especially with smokers. So, you need to be careful not to smoke, but they both have to come for regular follow-ups, and the treatment is based on their type of glaucoma and again the type of macular degeneration. So they will be visiting a glaucoma specialist as well as a retina specialist, but this category of patient is definitely one who should be coming regularly for follow-ups, and they have to be screened for their vision. For example, in macular degeneration, we usually give a chart to the patient which is called Amsler grid to monitor their symptoms, because dry RMD is still okay. It's a very slowly progressive disease in most people. But if it gets converted into a wet ARMD, that's something which is vision threatening. So early AMD, because of the changes on your macula and retina, that's the area where the vision gets formed, you'll start having distortion, and these grid charts which we give you, they monitor any kind of early distortion. So that's an indication that please go and visit your doctor and let him examine you and run those scans to see whether it's actually progressing or not. So, Divyajot is saying, ma'am, does excessive water discharge and nasal discharge pertain to increased production of aqueous humor? No. So the aqueous, there are two kind of fluids in the eye. One is what you see on outside, the tear. Now there's a separate mechanism for tear formation. So there's a lacrimal gland on the side of your eye, and when you blink, it kind of takes out the tear film in your eye, and then there are three layers there. One outside lipid layer, of course, is produced by the glands of your eyelids, and then there is an aqueous layer, and then there's a mucin layer. So that's the tear. And then there is a fluid which is inside the eye, which is more relevant for glaucoma patients, where your black portion finishes. All around, from inside of the eye, there is a structure called ciliary body that produces this aqueous, the fluid of the eyes. We call it the maintenance fluid of the eye. So that gets produced, and then there is a draining area from which it goes out. So it's a fine balance between these two inside, incoming and outcoming fluid, where the eye keeps a normal pressure of say 10 to 21. When either the production of this water is more or the drainage is less, then the pressures start rising, and it all happens at a very small molecular level. So it doesn't come out of the eye. So there is nothing like aqueous coming out of the eye, and the tear film is totally separate, and this is totally separate. Uh, Pavan is asking, what are the tips at home which can control pressure or promote eye health? No, Pavan, there is nothing which controls eye high pressure. You cannot do anything about it. This happens at a very small structural level. And promote high health. See, everybody knows. Thankfully, you know, eye is one organ which doesn't require much maintenance. So unlike your heart and other organs where you have to do cardio or gymming to keep your heart pumping and in good shape, your eyes are anyways exercising billions of times of the day. Every time you're blinking, you're so many times you're focusing at different objects. Trillions of times your muscles are working on their own. Um the outside things which we have already discussed, that when you're spending a lot of time on screen, take frequent eye breaks, look away from the screen, 10 10. So every 10 minutes close your eyes for 10 seconds, or every 20 minutes look at 20 feet, close your eyes for 20 seconds. You can lubricate your eyes, you can do cold compression and things like that. Eat good food. Carrot is a complete myth, it's an overrated thing for the eye. All green vegetables, all yellow green vegetables and fruits, most of the things have a lot of antioxidants. So fish, nuts, eggs, good balanced diet is good enough for the eye. Keep going for regular checkups. One of the most important thing in preventive eye care, if you want to keep your eyes healthy, is to go for regular checkups, because there are quite a few eye diseases which don't have any symptoms. We take our eyes for granted. Till the time you're seeing well, we never even bother. We are not even aware of their existence. It's only when a problem occurs that we are running for medical help. So there are certain risk category patients, like all diabetics, all hypertensive patients have to, it's a must for them to go for regular retina checkups. Now, diabetics can have something called as diabetic retinopathy, and it doesn't matter if sugars are controlled. Doesn't matter in the sense that it's not that you should not come for follow-ups. It's great, you have to maintain your blood sugars well. That's how your diabetic retinopathy remains controlled. But even a well controlled blood sugar diabetic patient, after many years of duration of diabetes, say after 10 years, 15 years, 20 years, is prone to get diabetic retinopathy, which again doesn't have any symptoms in the initial phases. And you wouldn't get to know. It's only when you go to a doctor, he dilates and sees your retina, that he'll see these small bleeding spots, or exudates or any leakage from your blood vessels. And he'll be the one to show your retina picture that, look, this has already started and be careful and start coming for follow-ups. So depending on the stage of diabetic retinopathy, we either follow you up, just do a good blood sugar control, or we may need to do a preventive laser and so on and so forth. So diabetics, hypertensives, people who have thyroid problems, people who wear minus glasses like me, who are myomes, because our eyeballs are longer. So the retina is kind of stretched. So if you put a cloth on this much frame or on a larger frame, वो कपड़ा तो retina stretch hota hai. So there could be a tear or a break in the periphery of the retina. Again, most of the time silent. So one random case which happens and says retinal detachment ho gaya is there because there was an undetected hole lying there, or could have developed fresh, So there are certain category of people who should keep going for regular eye checkups once a year. But for the rest of the time, apart from these basic precautions on how to spend time on screen, good balanced diet, posture while reading, and all that, I think that's good enough to maintain your eyes. Is there any implant? Yes, of course, but that's used for uncontrolled glaucomas. So most of the glaucomas get controlled very well just on eye drops, by keeping your eye pressures controlled. If not, there are times where patients are not able to come for follow-up. For example, somebody is in a village, remote area, periphery, or his pressure is not controlled on eye drops. We do filtering surgeries, and in filtering surgeries also, because it's a complex thing because of many types of glaucoma and stages of glaucomas. Then we do something called as valve surgeries, which people have now started doing are also doing it as a primary surgery. But valves is usually reserved for advanced cases which are not getting controls by either drops or laser or by filtering surgeries. So there is a valve which we put in the eye, which allows your aqueous to flow out in a graded manner. So it's an implant which is done as a daycare surgery under local anesthesia. Mr. Joy wants to know, my father had undergone cataract surgery, both eyes, but now he has eye pain in the left eye. Sometimes it's necessary to check for glaucoma. Yes. So that's a very good question and a very valid point, that once we get the eyes operated for cataract, many a times people feel that it's all done and dusted. My eyes are absolutely fine now. No, cataract is just one small part of your eye. Basically, the lens has got opaque. So your light doesn't go inside properly. We operate, we remove your cataract, put in a new lens, but that's just one small part of the eye taken care of. The rest of the eye could still have so many other problems, especially in old age. So right from your cornea to your eye pressures to your retina to your optic nerve, there could be other things. So having cataract surgery doesn't mean that it's all done now and I never have to go for an eye doctor. We always tell post cataract people also to keep coming to us at least twice a year. So once in 6 months or a year. But and when they come for their yearly checkup after cataract surgery, eye pressure and other things, optic nerve examination is a mandate part of those visits. So they will definitely be checked for glaucoma. And many a times after cataract, few years, a person can develop glaucoma at any point in time and stage in life. So if you don't come to us, then we wouldn't know that you're suffering from this, and it could become late, and you could have irreversible changes. So thank you for bringing out this point. Cataract surgery patients also need to come for regular follow-ups. And which one is best for juvenile glaucoma, medication or laser surgery? So depends on the profile. This is something which will be answered by the glaucoma specialist after examining your eyes. Open angle glaucomas are treated both with eye drops, or we do laser therapies in your angle to open up. There's something called as a meshwork, trabecular meshwork. It's छन्नी जैसा एक area होता है जहाँ से fluid निकलता है. And sometimes by laser we open up these meshworks so that your aqueous goes out. But there are pros and cons. The success rate is also a bit limited. So one has two ways. So we can either keep you on drops or do a laser procedure, or do a combination for both, depending on case to case and depending on what your target pressure is, because 10 to 21 is a wide range of eye pressure. Whom to keep on 20, 21, and whose pressure we want to bring down on 10 is decided by looking at the complete spectrum of your different eye presentation and other things. So this will have to be taken up after examining you only. Is it necessary for a patient who's on rheumatoid arthritis to go for regular checkup? Yes, I said in the beginning of my talk, and thank you for bringing it up again. People who have autoimmune disorders, people like who have rheumatoid arthritis or ankylosing spondylitis, Sjogren's, they could have eye issues. So one is inflammation of the eye. There's something called as uveitis, where there is eyes get inflamed as a part of this inflammatory process in their body, or they could have dry eye and other issues. So people with autoimmune disorders, even your physician and the rheumatologist will tell you to go for regular eye checkups. Then there are some autoimmune drugs which, when physicians part, and especially now in COVID days, you're hearing a lot about HCQS, the hydroxychloroquine. And these medicines can cause a problem in the macula for some people. So whenever people start on HCQS, start doing some other tests like G6PD and doing a cardiac evaluation, an eye checkup is also very important. And when people are taking HCQS or chloroquine, we tell them to watch out for any eye problems, especially a black spot coming in their vision or distortion in the colors, so that we know that this is HCQS induced problem and we can stop the drug. Mostly it's reversible. So don't be scared about that. But yeah, coming back to your question, rheumatoid arthritis does require follow-up. Mr. Kishore is asking, one of my relative having detected glaucoma since 4 years is living in remote place. He's using eye drops, but during these drops, as out of stock. Oh, that's a very good question that you've asked, Mr. Kishore, because a lot of people are facing this problem. What I would suggest you is that whatever medicines you have, take at least for 3 months, take a refill. Now, whatever medicines you're not getting, and we've had calls because there are one or two common drugs of glaucomas which are getting out of stock with a particular company. So look for the same composition, the same molecule in a different company. So the glaucoma drops supply is not a problem as of now and will not be in the next 6 months or a year also. But a particular company may run out of their stock because of the problem in the chain supply as of now. So for some time, if it's out of, instead of changing your molecule, or using any other drop, just ask your chemist that this particular molecule. So there are different drugs of glaucoma drops. So whether it's a beta blocker or an alpha agonist or a prostaglandin analog, and whatever you're taking, the constituent जो molecule है उसके अंदर का, वो आप अपने chemist से पूछिए कि मुझे दूसरी company का option दे दो and take that. If none is available, then you ring up your doctor or any other doctor and he'll give you a substitute. But don't stop putting your eye drops for sure. Mr. Rahul is asking, due to lockdown, one of my friend mother is not putting glaucoma eye drops since last 1 year due to non-availability of this particular brand. So this is exactly what I answered for you, that not putting the drops is not a solution at all. Please take a substitute, take other company medication, or call up your doctor and ask him what else can you be taken. Mr. Bhupendra is asking if any patient age 60 years suffering from since last year type 2 diabetes after diagnosis and started treatment, how is controlled very well, but he started smoking. So yeah, I mean, see, that's a no-brainer. Diabetics, anyways, are at a risk for various eye problems. As I explained, diabetic retinopathy is a primary concern. They will have increased chances of early cataracts or even glaucoma for that matter. And there's something called as macular degeneration, which anyone can get affected with. The smoking is a no-no for that kind of profile. So absolutely, that has to be avoided. How to overcome depression, anxiety of patients having glaucoma and dry eye syndrome? So I think what you want to ask is whether these drugs are causing, because there are some antidepressants and anti-anxiety medicines which can cause dry eye syndrome. And I mean, your doctor will be able to advise you. And usually, drug-related things happen, after either immediately or after a period of time. So once you stop the medication, those things get reversed. So it will be, after the lockdown, it will be a good idea to go and get your eyes screened for such problems. If anyone, Mr. Mishra is asking if anyone taking HCQS, is it required for eye checkup if not feeling any eye problem? So, yeah, as I said earlier, and thank you for bringing it up. And we are also having these debates in our, daily guidelines are being formed when we talk about COVID management do's and don'ts. Now, HCQSC, if ideally, as I said, that people have to be screened properly before giving HCQS. So it's a debatable topic right now, and the doctor's opinion is divided. Some believe that you should have a basic cardiac evaluation, G6PD evaluation, and an eye checkup before doing HCQS. Then there are a lot of doctors, especially in India. It's a very popular drug for autoimmune disorders in India, who've been giving this drug for many years, and they claim that this is very, very safe. So if you don't have a cardiac history, and don't combine it, because there are certain drug interaction cases which have been reported lately. And so if you're not having any other systemic problem, then talk to a physician. Don't take it without medical supervision. See, HCQS right now has not been advised randomly for general population. So there was a fear when COVID started, and a lot of people started stocking it up, which was very painful, because the people suffering from autoimmune did not get it. One, you have to remember that drugs in India, by and large, will not be a problem. Now, drug companies, pharma companies, it's only a problem temporarily in your location, could be a problem with the chain supply, because that is what is getting affected, transport and other things. So don't hoard up things. Medicines will not be a problem. We have enough in India. HCQ has been stocked up for Indian. But don't take it randomly. It has to be taken, please mark it very carefully. It has to be taken under medical supervision. It's not like any paracetamol which you can just pop up by yourself. It can have serious and dire consequences. Even now, it's been prescribed only for health workers, only for frontline workers, and of course, if there is a cluster, then the guidelines would come up by the concerned authority people, whether it should be taken or not, because a lot of research work as we speak is happening. So let there be a proper guideline. According to that, you will be advised whether you should be taking it or not. Right now, it's only for people are with COVID are being treated with it, or people who are coming in contact with COVID patients who are supposed to take it, but not random population as a preventive. Though I think in one of the cluster areas also it's been advised, but please do not do it without medical supervision. So call up your physician and have a word with him about this. Is there anything new for glaucoma patients related to stem cells? So a lot of researches are happening on stem cells. Various clinical trials are in various phases, but there is nothing really concrete which we can offer you right now. And depending on future progress, if there is something, then yes. But right now, there isn't anything which is promising to come out. In fact, not in couple of months. Also, it's going to take longer than that. Any condition in that case, glaucoma medication is contraindicated? No, that would be difficult right now to answer, because that for that your eyes have to be examined and a glaucoma specialist has to advise you. Of course, there are some medications. So if you have narrow angles, there are some medicines which will cause your pupil to dilate a bit, which can again cause further increase your you know uh, narrow angle problem and increase in your eye pressure. So when you go to a glaucoma specialist, they always take your systemic history and they always ask you what medication you are on. And there are few where it's called drug interaction. So there are certain medicines which you cannot prescribe with A or with B or C, X, Y. So that your doctor will be able to guide you. Mr. Singh is asking, if lockdown opens up, can you do cataract surgery instantly? Well, this is a topic which is being debated on an everyday basis all across. So, because you cannot be in a lockdown forever. The virus is not going to disappear on 3rd of May. So, we will have to do medical things. We will have to operate, but it will be a very different scenario. We will have to do it with lot of precautions, lot of safety measures, which, let me assure you, that the doctors and hospitals are completely taking care of. uh, as we speak, there are millions of doctors out there who are forming guidelines and SOPs on processes on how to take it forward. So instantly means there will be a prep time for each clinic and hospital as they are planning their SOPs, because depends whether it's a small scale clinic or a big hospital. And everything will be formulated accordingly. But eventually, yes, the work has to start. The people will need surgeries. They will have to be done. Be prepared. So what is going to be different now when you come to the hospital is, one is that everybody will be wearing a mask. You will also be wearing a mask. Most people will be carrying sanitizers for some time, and which actually is a good habit. Wearing a mask and keeping a sanitizer, I think this should be a long term thing. Social distances will be maintained even in hospitals, even in operating theaters. Adequate precautions will be taken. Be prepared for more waiting time. So gone are the luxuries where we will have 20 people, and we'll just see them quickly or try to make sure that you go back fast. Now prepared to spend a lot of time in the hospitals, because there'll be only few patients at a given time, and your waiting time may increase, since all these precautions will have to be taken care. The doctors will change their gloves, the protective mask which they are wearing, the covering or their gloves. So be prepared for that. But yes, surgeries will start depending on how geared up each hospital and center is to go forward with adequate safety measures. You can't stop operating completely. So people are working on that. Is there anything new which may help glaucoma patients other than medication and surgery? So we haven't spoken about laser. Between medicine and surgery is also laser, but it's not new. There are modifications which keep happening on the options and the type of laser. But in open angle, there's something called as SLT, where I said that the laser modifies the trabecular meshwork and helps in bringing down the pressures with or without adjunct to the drops. So, and there are a lot of neuroprotective drugs which are under research and trial. So, ultimately, the eye pressure is affecting the retinal nerve fibers or the ganglion cells, behind. So, if we can somehow protect them, because there is a category of patient, despite pressure control, they will progress. Their fields are deteriorating, and the nerve fiber is getting thinner. So we know that eye pressure is not just the thing. So there is a vascular component, blood supply component. There is an antioxidant theory over there. The ganglion cell apoptosis. All the cells have a life, so that there's a life cell attached, and they die faster. So neuroprotective drugs are supposed to maintain them, keep them viable for a longer time. So they are being researched for, and we are hopeful that new things will come forward there. So I think that's quite some bit, and we should end this session now with just reminding you again about the safe practices. So, just to reinforce what I said earlier. Stay home right now, but don't ignore anything serious in your eye. Do seek out help and come to the hospitals. It's as I said that we will have to move forward from here. Wearing a mask, even if it's a cloth one, please distribute it to your helps. It's reusable, the cloth one. Leave the surgical mask and the N95 for the frontline workers. Maintain social hygiene, which I'm sure you'll be doing. Get yourself empowered with the right info. So go to the proper websites to read the latest guidelines. For medical info, reach out to your doctors or read research publications. Go by what is just circulating out there. One last question. I was winding up, but I'll take this one. One of my friend father lost his one eye vision due to glaucoma. Do you prevent any precautions or suggestions to him? Yeah, absolutely. So this is a very condition that it doesn't get detected and one eye is already lost, and the eye which is remaining is actually a precious eye now. So he has to keep going for regular follow-up, being a glaucoma specialist. And as long as you being monitored properly, it's safe. So like I have patients who are maintaining one eye good vision for the past 20 years also. So it's not as if there is no. So coming back to what I was saying earlier, that please maintain that, keep an optimistic outlook. The hospitals are here to help you, and for anything else, you can reach out to us. Stay safe, stay healthy, and a lot of good wishes to everyone. A lot of good healing wishes to everyone. So thank you for joining in.